we talked earlier about its anti-cancer effects. We talked about its anti-atherosclerotic effects, how it can impact blood pressure, how it can impact the microbiome, how it can impact the body's ability to secrete insulin and regulate insulin sensitivity. I mean, there's so many impacts that berberine can have. Now they're studying it as an anti-aging possibilities. And so that brings in this comparison that I want to draw for you. So berberine versus metformin. Now, metformin is often touted as a drug that potentially increases longevity, or some people like to refer to it as an anti-aging agent. So I want to draw some comparisons between berberine and metformin, because metformin, a lot of doctors are saying, hey, just take it just to take it for its anti-aging and longevity impact. But let's do a comparison. So if we look at the comparisons here, we can see that berberine and metformin both do these things. They both reduce fasting and postprandial blood sugars. They both reduce hemoglobin A1C, which is an average of long-term blood sugar. They both lower LDL-C, that's low density lipoprotein, that's a type of cholesterol. They both lower body mass index or weight. They both are anti-inflammatory, and they both improve insulin sensitivity. Okay, so these are functions that we've studied that we know that both of these agents can do. Now, berberine also can lower blood pressure, it can lower triglycerides, and it has a very minimal side effect profile. If we really want to add some things here, we also know that berberine can also improve microbiome dysbiosis. So you've got an abnormal gut bacteria, berberine's very helpful in improving of that. Now let's come back over here to metformin. Unlike berberine, with minimal side effect profile, metformin does have a potential toxicity. As a matter of fact, I think it was in 2020, there was a type of extended release metformin that they had to pull off the market because it was causing lactic acidosis in a lot of patients. But metformin a lot of times is not tolerated clinically in patients because it causes severe, not in everyone, but it can cause severe GI side effects. So things like diarrhea and stomach pain, etc. We also know that metformin depletes vitamin B12, it depletes folate, and it depletes CoQ10. Now, why is that important? If we're looking at B12 and folate in terms of what they do, these are two very important B vitamins. And what do? They regulate the synthesis of DNA and RNA. They regulate a process in the body called methylation, which is very important for detoxification and for regulating a chemical called homocysteine. One of the problems with depleting of folic acid, or folate rather, and B12 is that it increases homocysteine. And when you increase homocysteine, you actually increase the risk for heart disease. It's an independent risk factor for cancer, heart disease, diabetes. It's an independent risk factor for bone loss. And so we don't like to see elevations in homocysteine. And when you're taking a drug like metformin, you do see depletions of B12 and folate. Now, the other thing metformin depletes is CoQ10. So again, if we're talking about, pound for pound, one versus the other, CoQ10 deficiency has been linked to mitochondrial dysfunction. And when your cells and your mitochondria in your cells don't have adequate CoQ10, they can't generate energy as effectively or as efficiently. We also know that CoQ10 deficiency can lead to muscle aches and pains, arthritic pains. We know it can lead to brain fog. There's some research linking CoQ10 deficiency to early onset dementia or Alzheimer's disease. We know that CoQ10 deficiency can create liver problems. So this is not something we want to run into. And again, I know a lot of doctors tout this as a very powerful anti-aging and improving the lifespan potentially type of drug. But for these reasons alone, I would say proceed there with extreme caution. If you are considering using metformin in that regard with your doctor, you definitely want to make sure you're asking him or her to monitor your B vitamins and your CoQ10 status. Now, if you're using berberine, you get all the same potential upside. right? But you don't get the potential downside. And so for that reason, this would be why if I were looking at doing one versus the other, of course, my decision would fall pretty easily toward berberine versus metformin. Now, again, with all these different effects, it's anti-inflammatory, it has anti-cancer properties, antioxidant properties, it also has antimicrobial properties. We want to talk about how to supplement with it. So if you're interested in kind of helping support your body with those things, how does one go about supplementing with berberine? Now, typically berberine is available in capsules or tablets. Typically, it's anywhere from, I've seen it anywhere from 100 to 500 milligrams as far as capsules or tablets are concerned. But the recommended dosage, as a general rule of thumb, is a starting point is about 500 milligrams, 3 times per day, taken right before meals, so right before you eat. Now, a couple of things. If you're going to take berberine, one of the potential side effects can be nausea or gastric upset or diarrhea. So if you're tender in your stomach or have a history of that, you might want to consider starting with a lower dose just to assess what your tolerance level is. So start at that lower dose versus that higher dose. You also, if you're taking any other kinds of medications, you're going to definitely want to talk with your doctor for personalized advice and potential interaction advice, because berberine does have some contraindications in certain situations. Let's talk about some of those. So one of those, let's see, who should avoid berberine? Well, there's a few folks that shouldn't consider it. One is expecting mothers. And one of the reasons why is berberine has the potential to increase contractions in pregnant women. And so especially if you're in that later trimester, you don't want that. You don't want to have premature contractions. So it's best to avoid it. Now, we also know that it's best avoided in infants as well as in breastfeeding mothers. One of the reasons why, because it passes through breast milk, and so it can go to the infant. And one of the reasons why is berberine affects and impacts the liver. And one of the things that it can impact is the ability to break down or metabolize something called bilirubin. Bilirubin is a byproduct of red blood cells. And so with infants, there's some research showing that there's a condition called kernicterus, which is where bilirubin is not being properly broken down, and so the infant's skin becomes very yellow and jaundice. The eyes become yellow and jaundice. So again, it's just best for these 3 types, the babies, the breastfeeding mothers, or the expecting mothers, to avoid it. Especially avoid it if you're not under medical care. Now, if you're considering it, make sure you talk with your doctor about it. Now, there's some other things here. So other possible side effects of berberine use, again, it's generally safe, but it can cause stomach cramps, diarrhea, and or constipation at high doses. Now, this is typically not something that I have clinically seen in doses at 1,500 milligrams a day or less. But when you start getting into that 2,000 plus milligram a day range, this is where we'll typically start to see some of these things happen. So just be aware that that is a potential possibility. Now, if you're taking certain types of medications, you want to be aware. So there are some drug interactions that can occur with berberine. Berberine impacts the liver, and if the drugs are metabolized by the liver, it can actually interfere with how those drugs might work. So again, interactions with medications, especially those processed by the liver, it's important to consult a healthcare provider before use. So cyclosporine is one of those medicines. Dextromethorphan. Dextromethorphan is like an anti-cough syrup type of medication commonly found in things like Robitussin. And then you also have losartan, and this is not just losartan, but I would put other ARBs in that category as well. Now, this is a class of blood pressure medication. ARB stands for angiotensin receptor blocker. And so if the name of that blood pressure lowering drug that you're on ends in ARTAN, Artan, it's an ARB. So you really want, if you're considering berberine, you want to talk with your doctor about it, because it can impact the way that this medicine's metabolized. As you see, the liver activates losartan to make it work. Berberine might decrease how quickly the body activates it, which might decrease the effectiveness of losartan. Now, also remember too, what did we say earlier, is that berberine can lower blood pressure. And so if you're on blood pressure medicine, beyond the impact of the liver, if you're on blood pressure medication, if berberine lowers your blood pressure further, you might push it down too low. That is possible. And then, what does low blood pressure cause? Dizziness. It can cause a lot of fatigue and shortness of breath. So you just want to be aware. Again, if you're on a blood pressure medication, you definitely want to check with your doctor. And if that's the case, monitor your blood pressure if you are using berberine. Drugs, then again, drugs that lower blood sugar or blood pressure, because berberine, again, what did we say it did? It lowers your blood pressure, it lowers your blood sugar. So if you're taking drugs that also do those things, you could push both too low, and the cumulative effect could be too strong, leading you into problems. Now, we also know that berberine's an anticoagulant, and so if you're taking anticoagulants, these are drugs like warfarin or Plavix, those types of medications that thin the blood, should be used with caution when you're taking berberine, okay, or rather vice versa. Don't take berberine without talking to your doctor about it, because again, if your blood gets too thin, you can get internal bruising and even potential hemorrhage that can become very, very problematic. So, bottom line, if you're using medications and you want to add therapeutic doses of berberine to your repertoire, take berberine to your doctor or a pharmacist and have a conversation about the potential side effects and interactions, and make sure it's safe for you. If your goal is to get off of your medications and you're trying to, for example, reduce your blood pressure or your blood glucose or blood sugar medications, and you're looking at berberine as a potential alternative, you want to do that under guidance and you want to do that safely. So don't just go cavalier and start on 2,000 milligrams of berberine and hope for the best. Do it with great supervision.